Hello and welcome back to the channel. You guys have been asking me to bring someone on to answer your questions about health insurance. And I've got Alexander with me. Alexander is a Thai American and he's going to answer some of the questions that you guys gave me and I'm going to ask him. And the first one is, and I know this is a loaded question, but generally how much is health insurance here in Thailand?
You know, as Tony mentioned, it is almost like a question of how long is a piece of string, right? The insurance can range quite drastically depending on the level of cover you want and of course on your age, right? So if you want more information, I would suggest just reaching out to our quote engine or to my email directly, and I'll be more than happy to give you a personalized quote.
So one of the biggest questions you guys ask is, what about pre-existing conditions? So what about it?
Yeah, I mean, we get this question a lot. As a general rule of thumb, we do not cover pre-existing conditions. Typically with health insurance, the way you want to think about it, particularly here in Thailand, is that it's meant to be a guarantee against things that have yet to occur, as opposed to a treatment for things that have already occurred, right? There may be some exceptions, particularly if the condition is not too serious. So as an example, if you've had maybe a broken leg for maybe your right femur, as an example, then moving forward, maybe in a couple of years after you sign on with us, we can then cover that body part. But as a rule, pre-existing conditions are not covered.
All right, and so for more obviously in-depth, specific, they should contact you and ask you.
Yeah, so we will underwrite every plan, right? So basically you'll submit an application to us, our medical team will look through it, and then we'll give you a formal, what's called an offer letter. Now this offer letter will be very transparent, right? We really pride ourselves on this because that offer letter will be very detailed on exactly what you're covered for and what you're not covered for.
Okay, so next question. So let's say somebody has an insurance policy with you and they want to go, let's say, to a private, really nice hospital, like Bangkok Hospital is really nice. Or, do they have to go only to a public hospital, or do they have a choice? How does that work?
So that's a great question, right? And that's one we get really often. And I just want to clarify one thing. And that's in regards to the quality of care here in Thailand. Now, the quality of care here in Thailand, I can say very confidently, is world class. Now, the doctors that work in the public sector or the public hospitals, the thing is, many of them, they will have like a full-time position at a public hospital. But the thing is that they will have also some, maybe they'll work for a certain days or whatnot in a private hospital. So really the quality of care, no matter where you go, is excellent, right? The difference between the hospitals really is the maybe how modern the amenities and facilities are. And another big one that really matters for a lot of people is the quality of the service, right? Now, if you want like a great, a service experience, most modern rooms, then a private hospital is probably where you want to look at, right? But the fortunate news with Pacific Cross is that we operate on direct billing network. Right? That means that it's a cashless payment system, and this network we have with over 450 hospitals. Now, this includes some really notable private ones that you're probably thinking of, like your Semitivej, your Bangkok hospitals, but it also includes a variety of public hospitals, which like I was saying, gives great care. So really, no matter what you go for, be it if you choose a very high cover plan, you can get the best room, maybe the great service at a place like Semitivej, or if you want to keep your costs down, just want to reassure you that no matter what your choice is, the quality of care is excellent.
Let's say you've got an individual, he's in his 70s, and he's getting ready to turn, I don't know what the age caps or if there is one. Let's say he's going to turn 70 or he's going to turn 75 or 80. Is there some sort of age limit to where somebody's covered and then they cannot be covered?
So, there's obviously a concern for many people. They do plan to live as long as possible.
Right.
So, great news is that our plans are on a lifetime renewability, right? Our oldest policyholder, I believe, is 97.
Wow.
I hope one of you guys can beat that record, right?
Right.
We are rooting for you. So
I was not expecting that answer.
Yeah,
that's great.
That's great, yeah. So hopefully you guys can beat that record. And that does give, I think, a lot of reassurance to people, because that is something that they're concerned about. Because, obviously it is kind of like the worst case scenario where you're with an insurer, into your mid or late 70s, and then if they cancel on you, then you're stuck with, all these pre-existing conditions that you've quite naturally accrued. and you're maybe left out in the cold, right?
Right.
Fortunately, that's not the case here.
Great, because I know a lot of people have to have insurance coverage to keep their visa.
Exactly.
So another question, is there any waiting period for any treatments or conditions?
Yeah, great question. So that's one we get also pretty frequently. Now, there are waiting periods, and the waiting periods can vary based on the plan. Based on the condition, right? So, for example, COVID is a 15-day waiting period. Most conditions that exist, there's a 30-day waiting period, right? For most conditions you can think of, it's typically 30 days. And there are certain exceptions for things like cancer, hemorrhoids. Those are a 120-day waiting period, right? And the whole idea is just we want to ensure that when you're signing up with us, right, you don't already have this sickness and you're not seeking the insurance as just a treatment for something you already have.
So do you have any tips for everyone on how to keep the cost for health insurance down?
So there are a few methods. I think the two best ones are deductibles and removing the outpatient. So for some individuals, they don't get sick very often. There are people that you never see them with the flu, do you?
Right.
They may go to the hospital literally once every few years. In which case, something like removing the outpatient, right? So outpatient is just any kind of healthcare that doesn't require you to stay in the hospital overnight. And it's just for more minor things. Maybe some people they do want to just go to the hospital just in case they have a cold, right?
Right.
And other people, you never see them in the hospital. So for those people that never go to the hospital, it's something that's a great option because you're not claiming for the minor things because it's just not the kind of person you are. And that way you rack up no claims discounts. That way you're paying for no claims for 1 year, it's 10% discount. No claims for 2 years, that's 15% discount. No claims for 3 years, that's a 20% discount. When you combine that with removing the outpatient, which in of itself is a 20% discount, in a few years you can be paying 40% less.
Okay.
So it's really a great option for people that don't go to the hospital often and they're thinking like long term, okay, how do I keep my costs down over the next few years, which is really what matters, right? Because the health insurance is a long-term thing. Right. It's not something that you're going to buy and forget about, buy and not have in a few months. It's something that ideally you would buy and have for decades.
Okay.
Really, right? Especially if you're a retiree here.
Yeah, I think my wife and I have it to where we only have major medicals. So in other words, we pay for our own outpatient, which is no big deal. The costs are low here compared to the U.S. anyway.
Relatively speaking, right?
So yeah, that makes perfect sense.
Yeah.
So are there any perks or any benefits that come along with having a health insurance policy here in Thailand?
Yeah. So it depends a lot on the company that you sign up with, right?
Okay.
With Pacific Cross, we do offer a few key benefits. So one of them being Assist America. So we're partnered with this company, and basically it offers emergency repatriation, be it to your home country or to Thailand. Now that's really great news, right? Because it can happen where maybe you're overseas and you get into an accident. It does happen, unfortunately. With this service, with this partnership that we have, we can bring you either to Thailand or to your home country, whichever country you would rather be sent to, right? And it's fully covered, so that's it can be a huge cost. Imagine like the cost of an airplane, an emergency services just to be sent across countries. The bill can be quite exorbitant, right? Fortunately, with Assist America, that's not something you have to worry about, right? Some other key perks that at least Pacific Cross offers is physiotherapy. So physiotherapy is not something that every insurer might offer. It may be something that is something you have to add additionally. You have to get like a special cover or special plan for it. Fortunately, we do have a certain amount of physiotherapy sessions that are built into the plan. So you can get that no matter what, right? There's also overseas cover. So we do offer overseas coverage for individuals. There are certain exceptions, being America, Hong Kong, and Singapore, just because the costs of the healthcare there is quite high. So there's a 35% copay, essentially where the client will have to pay 35% and then the insurer will pay the remaining 65%.
So if you're wanting more information, let's say we didn't cover the question that you have or you need him to elaborate more in detail for your specific situation, make sure to contact Alexander using the link down below in the description. I'm sure he'll be more than happy to answer your questions for you. And anyway, thank you again for watching. We really appreciate having you on
Thank
the
you for
channel.
having me. Thank
This
you.
has
I'm
been
glad
like
to be here.
2 months in the making. We're finally got together. It's awesome. So thank you guys for watching. If you like the video, give it a thumbs up. If you haven't subscribed, please consider subscribing. And until next time, I'm going to say thank you in Thai, which is Kap Kun Kap.
Welcome.